Well, welcome everybody. We're going to give it about 2 more minutes to get the webinar started. I'm Teresa Kittredge with 100 Rural Women, and glad to have you with us today. So we'll give it a couple more minutes, and then we want to make the best use of time, everybody's time, and we'll get the webinar started. And just for folks' information, we are recording the webinar. We'll be sharing that afterwards, and sharing it out through as many networks as possible. So we'll give it 1 more minute, and then we'll get started, and we'll just let people join as they come. So if you want to introduce yourself in the chat, that would be great. Tell us where you're joining from today, and glad to have everybody here. Alrighty, I think we'll get started. We're just going to let people come in as they join, but I want to welcome everybody today. My name is Teresa Kittredge. I'm with 100 Rural Women, and we are just really excited to be able to um, share information today about Project Reach and have you meet these amazing presenters with us today. We are recording this meeting, and we will share it afterwards. We'll go through and get that out on our YouTube channel and our website and share it broadly in our newsletter also. A little bit about 100 Rural Women. We really are about creating connections and inspiring leadership. In a nutshell, that's really what we do. And our webinar series really is a way for us to share and better inform women, create connections, and we really strive to lift up the work and journeys of women leading. And all of our programs seeks to lift up and connect as we learn from one another. So just really happy to be able to host this today. A couple little Zoom things. You've all been on Zoom, but we always like to remind people, if you can have your camera on, that's wonderful. If you could mute unless you're asking a question, that would be wonderful too, so we don't have background noise. And we just want to make sure that everybody can hear and see and participate. We will have a active Q&A, so please, during the presentation, throw any questions or comments you have in the chat, and we'll respond to them during that part of the agenda. We're going to have a presentation, Q&A, and hopefully a good lively discussion so you can learn more about Project Reach. And I want to take this opportunity to introduce our presenters today. So Katie Rydberg is the program manager for the University of Minnesota Rural Health Program. And Katie is at the Rural Health Research Center at the University of Minnesota. She manages the operations and development of the Rural Health Program, which provides training and support for public health and health policy challenges in rural Minnesota, including the Project Reach Rural Experts Advancing Community Health Program. In addition, she's contributed to research projects related to access to care for rural residents and social determinants impacting rural health outcomes. Prior to joining the University of Minnesota, Katie coordinated a local substance abuse prevention and mental health coalition in Rice County, and she holds a BA in psychology and sociology anthropology from St. Olaf and an MPH in community health sciences from University of Illinois in Chicago. So welcome, Katie. And then I'll do a quick intro of Shelley. Shelley Munoz is a community health leader. Shelley is currently the STEM curriculum coordinator for the Brainerd Public Schools system, and she is a former education consultant for Sourcewell in central Minnesota. Shelley has more than 25 years experience in the classroom. She is especially passionate about science and STEM education, advocating for equitable opportunities for all students to find their voice in STEM, and supporting initiatives that enable young people to achieve what they once thought was impossible. Shelley holds a Master's of Science degree from the California Baptist University and is deeply committed to addressing mental health needs of individuals in rural communities. So welcome, Katie and Shelley. And I'm going to hand it right over to you, Katie, to take us forward.
Sounds good. Thank you so much. Hi everyone. My name is Katie Rydberg. Like Teresa said, I'm the program manager at the University of Minnesota Rural Health Research Center. I oversee the operations and development of Project Reach. I'm super excited to be here with you all and super grateful to 100 Rural Women for giving us this platform to talk about Project Reach. 100 Rural Women has been just such an amazing partner in the development of Project Reach and spreading the word about the program. So I'm very lucky to be joined here by my colleague Shelly, who is a participant in the program last year. So I'm going to try to get through my slides overviewing the program as quick as I can so she can share about her experience in the program. Project Reach stands for Rural Experts Advancing Community Health, and it is the community-based initiative of the University of Minnesota Rural Health Program, which is part of the Rural Health Research Center that is funded by the Clinical and Translational Sciences Institute and Office of Academic and Clinical Affairs. We launched our first program cohort in the summer of 2021, and we are currently in the middle of our fourth cohort and are starting to recruit participants for our fifth cohort, which is really exciting. So Project Reach is a program that provides health policy and leadership training program to community leaders in rural Minnesota. And we use the term community leaders very loosely as this really encompasses a number of different kinds of people, but basically anyone who's living or working in rural areas in Minnesota that want to do more in their community to impact health policy and create health, positive health outcomes in their communities. I'll be going over about the curriculum a little bit later, but in summary, our participants receive training and technical assistance around how to identify and use research and data around a particular health issue in their community, learn more about health policy and policy communication, and how to engage with their legislators and other local decision makers about these health policy issues in their communities. Throughout the process, our participants are connected with a network of mentors, resources, and expertise here at the university, but also from other people and organizations across the state who are doing great things to improve health outcomes in rural Minnesota. Our team really believes that people living in rural communities are the experts about their communities. And people in rural communities, they know what the problems are, they know what the strengths and weaknesses in their communities are. So combining the expertise about their communities with those working in the health policy sphere here at the University of Minnesota and with others around the state, this has made for such an incredible knowledge sharing and growth opportunity for both our participants living in rural Minnesota and those here at the university. And so it's been a real collaborative opportunity to create real impact through policy change in local rural Minnesota communities. So the program is a year long and starts and ends in the summer. Our cohorts meet twice a month, usually for an hour and a half each session via Zoom. And this program has been adapted from a graduate level health policy course that my colleagues, Dr. Carrie Henning-Smith and Dr. Katie Bacchus-Casamano, teach at the University of Minnesota School of Public Health, but it's just been tailored for rural community leaders. And so the structure of the program is split into two parts. In the first part of the program, participants identify a health policy issue that's specific to their rural Minnesota community and focus on the framing of this policy issue. And then in the second half of the program, participants focus on policy communication. And so ultimately, our participants write a policy proposal that they can then share with their state legislators and other local decision makers. I have a slide in a little bit that covers more specifics on the curriculum topics and guest speakers. But then outside of these formal group sessions, participants receive individual support from a pair of university-based mentors who we call learning partners, and I'll be touching a bit more about that here shortly. Um, what's really cool about this program is there is no cost to participate, and those who are selected to participate do receive a $1,200 stipend for their time and effort in the program because it does take at least 8 to 10 hours a month between the sessions, learning partner meetings, and just do the time and effort for doing the policy work behind the scenes, meeting with stakeholders, meeting with legislators, things like that. So we really want to be able to compensate people for their time and effort. Another benefit of the program is that we do cover the cost of travel to St. Paul for participants to meet with their policymakers about their specific rural health issues. And we also provide funding for each participant for other professional development opportunities related to their policy work, such as conference registration, professional memberships, workshops, and trainings. And once people complete the program, they are looped into our alumni network, and we stay in touch with them regularly about a number of opportunities. And this also includes our alumni fund, something that we started offering this last year. And this is an additional source of funding to support special projects and events that results from people's policy work in the program. So our learning partners help our participants work through the policy work in the program, such as providing support in finding and interpreting data, providing feedback on policy proposals, and helping them make connections with others in the policy and rural health field. And so our current learning partners are all faculty and staff members here at the University of Minnesota, many of who are internal to my team at the Rural Health Research Center, but we're also pulling from others across the whole university system. And as you can see by this whole list of partners, of learning partners that we've had, they're coming from a number of different schools, research centers, and campuses, including the Humphrey School of Public Affairs, the School of Social Work, the College of Nursing, the Extension Center for Family Development, as well as the College of Pharmacy and the business schools up in the Duluth campus. And so we match up our participants with learning partners based on the health policy issues that and subject matter expertise of our learning partners. So for example, if we have a participant who's interested in transportation policy, we've paired them up with faculty members who do research at the Center for Transportation Studies. We've also paired up people with specific learning partners based on the rural communities where they're from, because some of our learning partners are originally from rural Minnesota and have deep connections within those communities still. And so we also survey our learning partners at the end of the program. And so what I've heard from them is that they learn just as much from our rural program participants as they do from them, because it is such a knowledge sharing and collaborative opportunity. And for many of our learning partners, this has really positively impacted how they engage with rural Minnesota stakeholders going forward with their policy work and their research. Um, so in terms of curriculum, here are a number of different topics that we cover in the program. And these topics really encompass walking through the policy process. And we either have members from my team or myself leading a discussion on these topics, or we'll have guest speakers who are knowledgeable about a particular policy topic to lead a session. And so we've been so lucky to have some amazing guest lecturers for Project Reach. And this is just an example of who we've had speak during last year's cohort. And this includes representatives from local, state, and federal levels of government, librarians from the Minnesota Legislative Library, rural educators from the University of Minnesota Extension, and others with advocacy backgrounds. So really great group of people that we're working with to share information with our participants. And I know Shelly is going to touch on this, but one really cool opportunity in this program is that we have our own day at the Capitol in the spring. When we first started the program back in 2021, we weren't able to do this because of COVID, but starting with our last cohort last year, we had a day at the Capitol where we could have our participants, learning partners, and program staff hang out together. We toured the Capitol, which is what we were doing in this photo. We are on top of the roof of the Capitol with the statues behind us. So that was really fun. And then our participants had a chance to have meetings with their state representatives and senators to talk about their policy work in the program. And I would say this was the biggest highlight for our last cohort. And I'm really excited to be in the midst of planning for our day at the Capitol for our current cohort. And so, like I mentioned earlier, we are in the middle of our fourth cohort. And so we have had 13 participants across these four cohorts participate in the program. And I have a fun map here that highlights the participants over the last 4 years and the different communities across the state where they live or work. And as you can see, we've worked with people from all over the state. Most of our participants have had some sort of background in healthcare, whether that's being a public health educator, pharmacist, nurse, or community health worker. But we've also had people who don't have backgrounds in healthcare, including a farmer, a nonprofit executive director, and in Shelley's case, an educator. The policy issues that people have worked on are been really specific to their own rural Minnesota communities. And so in past cohorts, we've had a number of people who have worked on issues related to mental health in their communities. This year, we have two people who are addressing type 2 diabetes in their communities, one person focusing on that specifically for the Hispanic community in Nicollet County, and another person in relation to low income residents of Coochin County. And then this year, we also have two people whose policy solutions are really focused on transportation, but they're trying to address two very different issues. That being high rates of neonatal abstinence syndrome amongst pregnant women in Cass County, and another person who's focused on high rates of hospitalization amongst dialysis patients in northern St. Louis County. So because of some of these similarities and problems and solutions, it's been really fun to see the collaboration and brainstorming between our participants. And then we have someone this year who's focused on something totally different in the cohort, and that's been really everyone's been really interested in learning about, and that is nitrate contamination in private wells in southeast Minnesota. And so some really interesting policy issues that are being addressed in this cohort, and it's been really fun for everyone to learn from each other. We do also have time built into the program for unstructured time for participants to network with each other and learn from each other. And I think that's really a really fun part of the program as well. At the beginning of the program and also at the end of the program for each cohort, participants complete a skills assessment. And the skills assessment aims to evaluate competency levels for each participant around skills related to the program. And by completing this assessment at the beginning and at the end of the program year, the growth of the skills for each participant and the collective cohorts can be evaluated. And so this figure here just demonstrates the growth and competency for each of these skill sets that we're evaluating for the first three cohorts of the program who have gone through the entire program. And so overall, our participants have increased their skill sets around all of these policy related skills by about 47% over the course of the Project Reach program year. And participants have demonstrated the most growth in being able to communicate effectively with legislators and policymakers by an increase of 57%, being able to write a clear and effective policy proposal by 62%, and also being able to identify policies and practices that perpetuate disparities in health inequities and utilize equitable practices to improve health by 64%. So, if this program sounds intriguing to you or people in your rural networks, I'm just going to end my little bit of the webinar here by sharing how you can apply. And so, as part of the application process, we have an RFA and an interest form on our program website. Interest forms are due this year by Monday, March 17th. So, there is plenty of time to complete that. The interest form just asks for people's information and asks some basic questions regarding the rural community where you live or work, and what health policy issue is of interest to you to address in your community. And the reason we have this interest form is because we use it to screen out people just to make sure that they're a good fit before sending them a link to the full application, which builds on the questions from the interest form and allows for people to share a little bit more about their interest in the program, their policy issue in their community. And those full applications are due by April 21st. And the interest form, it screens out people who don't actually live or work in rural communities. We've had a few people over the years who have applied where they don't live or work in rural. And so we just want to make sure that we are not wasting anyone's time by having them complete the full application here. But we do also have a frequently asked questions document linked on our website where we outline some additional criteria regarding who's eligible to participate. And that's really specifically in regards to people who are affiliated with the University of Minnesota. But once people have filled out interest forms and applications, ultimately our selection criteria for participants really comes down to the policy issues that they want to address, geographic distribution of potential participants, and potential impact that their participation with that particular health issue will have on health impacts in their communities. Some other things that we do consider, other pieces of information that applicants provide to us in the application regarding their background, skill sets, and experiences, in order to make sure we have a cohort that's like well balanced and will work and collaborate well together too. So those are some additional things that we think about when we are selecting our cohorts. So over the last 4 years, we've accepted anywhere between 3 to 6 people to participate in our cohorts, but we really would like to be able to accept 5 to 6 people this next year so we can continue to grow our capacity. So if you are interested in um, filling out a interest form or sharing that around, that can be found, like I said, it can be found on our website. Teresa, I don't know if you'd be able to drop that information in the chat so people can have that. But I'm going to send things over to Shelly to share about her experience in the program.
Oh, goodness. Thank you so much. And thank you for giving me the opportunity, because for me, this was an amazing opportunity. And so I'm very grateful to Katie, Carrie, and just the work that we were able to do. So like many of you, I actually have just moved to Minnesota a few years ago and was looking to connect. And I have a friend from Sourceville named Heather Bandine who suggested 101 Rural Women. So I found myself hopping on one of our lunch webinars, and lo and behold, it was Project Reach and Ann Bussey. And I was so inspired because I'm like, I want to do that. I so want to do that. My work is centered around men's mental health. And the reason for that is right before I moved to Minnesota, unfortunately, in my classroom, I had a student whose dad committed suicide. And absolutely traumatizing, because what do you say to the student? How do you deal with the aftermath of that? But then moving to Minnesota at the time, I was working at a high school teacher in our local community, and another dad committed suicide. And so I began to see a trend, not only here in rural Minnesota, really nationally. And if you look at the statistics, they're staggering. But just with having young men that are my sons and seeing some of the connection to mental health, I really wanted that to be the work that I dove into. And I think just true to the motto of what 100 Rural Women are, is creating those connections and inspiring leadership. Through this, I was able, it's unbelievable some of the things. So I think what I'll do is just talk about some of the work that we did. So Katie, if we could go to the next slide, and just kind of like, on April 15th, we were able to go to the Capitol. I guess I kind of geeked out because it was just such an incredible experience. Working on policy, one of the things that really inspired me to work on policy as well is I had applied for a job in the process of moving to Minnesota. And the reason I didn't get it is I had no policy work. So I kind of became really intrigued on policy work, because honestly, after doing this work with Katie and the team with Project Reach, it is really vital that we all think about policy work and use our voices in our community, because if we don't stand up and make our voices known and create formative and better change, that's how all of this goes about. So I really began to see myself more of an advocate and having that voice. And it was very empowering to learn that I too could write a policy. And Katie will laugh with me with this. When I first started my policy, it was massive because I had all these ideas. And any of you've done policy work, now I know based on this work, it has to be very narrow and specific. And it was a great learning. And so Katie, if we could just go to the next slide. As we got there, I think the most exciting thing walking into the Capitol for our day is the United Way was there, actually doing their stand for advocacy for Children's Day and looking at some of their advocacy. And it was really inspirational to walk in and seeing people who were there, maybe for different reasons, but doing some of the same work on that day that we were able to go to the Capitol. Katie, next slide, please. And then, of course, here's our lovely picture. So what I wasn't expecting was like the behind the scenes tour of the Capitol. So that was incredibly fun. And, you kind of feel special when you get to do those things. The person who was in our cohort with me was Ben Cahill. He did his work really on Section 8 and looking at residential areas. And it was just so amazing. I feel our group was incredibly close. We learned so much together, and there isn't a moment of my learning that I ever felt unsupported. It just, every month there were great speakers who came in, incredibly knowledgeable speakers, and just the amount of connection that was made for me in this process is innumerable. I just cannot tell you how much it's meant and how much it's impacted some of the work that I've been fortunate enough to get to do. And next slide, please. So we got to meet with Sarah, who works for Tina Smith. And I have to say, for me, I was nervous going in because this is the first time I had ever worked on anything. So As you can see in my picture, I have all of my research and all of my policy, and I was so proud of it. But Sarah was amazing to me, and she really empowered me to listen to the policy work that I had done, and really empowered that that work would go back to Tina Smith, and that it was just an amazing experience. So someone who was novice in this work and a little nervous, it was very empowering. And I know that that's really what this program is all about. And so I just can't say enough. And that my work, she actually took my policy work and moved it on. So that was an amazing, amazing opportunity. Next slide. And then the next part is, this is someone that was a guest speaker when in the cohort. I don't know if she comes every time, but that was Erica Barnes. And I was so moved by her work. And she does Chloe's Fight for Rare Disease Foundation. And her work was so inspiring to me, because I think as parents, our worst nightmare is to lose a child. And after going through such a horrendous battle, she's now turned it into something proactive and working with policy. So her story is amazingly inspiring. And it's people like that that inspire us to do better for our communities and so forth. So it was just such an honor to get to see her at the Capitol. And I really learned a lot through her and her work as well. Continuing on, so Attorney General just happened to be there, and they were working on a project and it passed, and so of course I had to get my selfie opportunities. So I need to learn how to do the chin though and the selfies, but it was great fun, and it was really exciting to see our policy in motion in many different ways, because there's a lot of things that happen, and we need to have a voice in those items that are being passed and the work that's happening. Next slide. And so my representative, we were able to meet and discuss here in Region 5, Central Minnesota. And so it was just really nice to get to connect with our constituents here in our area. The next slide. And then again, Justin Eichhorn, we were able, really his work tends to be more with housing. So I think that Ben and him had a much stronger conversation based on the work that he personally does, and Ben's, the work he was doing. But it was really nice to get to sit into those conversations and learn other people's policy and how that works. And it may not have been the same as mine, but I sure learned a lot beside Ben and working with him as well. Next, please. Okay, so my policy work again was on men's mental health, and I really looked at what would be most beneficial. And based on the stigma attached to that, really worked on telehealth and creating some safety and getting help with that. And so as we have progressed on, I am happy to say that now I'm working for Brainerd Public Schools. And it's been kind of an amazing journey, because my work hasn't stopped. And so I think sometimes when we join a cohort like this, we get our work done, we get our certificate, and it's done, but it hasn't. I mean, this was kind of like the pebble that's now creating those ripples. And so just to back up a little bit, Heather Van Deen from Sourcewell is the one who introduced me to 100 Rural Women. So I'm very grateful for that, because I wouldn't know about you and or Katie with Project Reach. But when I was at Sourcewell, it was Cassidy Rice through Sourcewell who connected me to another agency within Sourcewell that was doing some great, or starting some great work at that time. And that's Nancy Eitner and Charity Herbst, and they were doing the community bridge makers. So they were taking a very specific look at mental health here in Region 5, because honestly, and when I was trying to break through those, it was very siloed, and it was really hard. I think there's a lot of people doing a lot of amazing work, but their work has been connecting it all and creating those bridges and putting everyone on the same page. Katie Barra, also with Region 5, is a part of that, who've been really amazing in helping support me in that. So when I was going through my policy work and doing the research, I was introduced to Karen Johnson, who was at Essentia, who was just the bomb at introducing me to everyone and anyone here in Region 5 that helped me get the support I needed. And Destiny Tiens too, with the Minnesota Suicide Prevention, gave me all the support, because when you're writing policy, you have to have a lot of data to go in and support that. And that's really where I was able, and of course our rural Minnesota was able to give a lot of those things. So where I'm at today is my work is continuing. It may not be policy, but Michelle Brecken, a board member at Brainerd Public Schools, has now started what we're calling the Wellness Health Task Force. And so with that, we have now created a strategic plan for Brainerd Public Schools. Some of the people that are on our task force are Brian Andrews from the Justice Table, Raina Bolt through Crowing Energized, Jennifer Podasky through the Smiles for Jake and Sarah Smith. And some of the exciting things with our mission, as we look at our mission, is to create supportive schools and communities where wellness, and we just had a meeting before just yesterday, and we decided to add brain health in that as well. But where that's prioritized, stigma is eliminated, because stigma is really a big piece of that. And every student and staff member has access to resources that foster well-being. And so with Smiles for Jake, we have the Hope Bot. And so that will go on to every kid's, we want to say Chromebook, but really they have something called Clever, and all of their apps are inside of there so that they will have access to mental health support. And we have one for staff, and we're putting it on the website soon for all of our staff members, regardless to where they're at, and community members. There are some exciting things in the works coming up with community to have a one-stop, so to speak, access for that. But I think that when you think about just the opportunity that Katie and Project Reach gave to me, and all the learning that I gave, but it's really based on that 101 rule mindset. It's all of those connections, and those connections don't stop, and they continue and they continue and they continue. Katie, could you do the last slide, please? And so again, I just wanted to say, you know, Destiny Teens has been very supportive with the suicide prevention. We actually were able to get a small grant here for Brainerd Public Schools to support our work. Sourcewell and Region 5 with the Community Bridge Makers have been doing an incredible work with all of those different silos and bringing it all together. So I think the reason I was so excited for this opportunity and encourage anyone to please do Project Reach, because it was life-changing for me. It gave me tools and skills that I needed. It gave me support. It gave me an amazing network of very, very special people. And that work just doesn't stop. It continues on. And Katie has given me opportunities to go to conferences with her and to continue to speak about this work. So it's been an amazing and empowering opportunity. Not to put anyone on the spot, but Nancy, I think I saw you pop in. Would you be willing just to say hi and kind of talk about the Community Bridge Makers and that work of what's being done? And I may just have put her on the spot. I'm not sure. I can't see
No, I'm
everybody.
here. I'm here.
Nancy,
Hi,
thank you. I'm
Shelley.
so sorry to do that to you, but I'm so inspired by the work you've done, because, you know, I kind of got accepted into this, and then your work was starting. And then I think really the point is how those silos are being broken down, and we're all coming together to do some amazing work.
Sure. So I
Thank
can
you.
touch briefly on what we're doing with Community Bridge Makers. It's an initiative that was convened through Sourcewell, the Region 5 Development Commission, and the Initiative Foundation in our region to just really bring people together and allow them to partner and foster that collaboration and just stand up the good work that's already happening and give it a little bit more power behind it by having just that greater collaboration opportunity. So been really honored to be part of that work. That group is working on 3 different things right now. One is the mental health focus that Shelley spoke about. They're also working on social cohesion and some of the division that currently happens in our region, and then also workforce development for the region. So
Thank you so much. I so appreciate that. But I think that it's just so important to see all the connectability of what these projects do. So Katie, thank you very much for giving me a voice and an opportunity to have a little policy dream that really has turned into a great connection with very amazing folks.
Thanks so much for sharing, Shelley. It's
Thank
so
you.
cool to see how your policy work from the program has evolved into this new position and work that you're doing with Brainerd Public Schools. So just keep up the great work. It's really exciting. Um, I just had, we have Shelly's information here, so if anyone wants to like quick jot that down here. But I think we'll be moving into our Q&A session portion of the webinar here. So I don't know, Teresa, if there are questions in the chat or if people want to
Yeah.
unmute. However, we can do this very informally here. And then I also have my information here on this screen, as well as the link to the program website where people can get more information. And it has a link to the interest form as well.
Yeah, and Katie, that's great. And we will share, just so everybody's information, we'll share all these links on our website. We'll do contacts on the website. We'll be sharing slides and the recording following the webinar. And we'll jump into Q&A here. I just want to add a couple quick comments because I just, again, want to thank you guys for presenting. And
And I'll
Katie,
stop sharing
what
so we can like have collaborative conversation here.
right.
So.
Yeah, there we go. Katie, what a testament to the work and to the program you've built. Just amazing. It's so much fun to hear 2 years later all the different things you've accomplished. And Shelley, what great stories to share in your journey. And I just, on a personal note, I loved your photos. I spent the first 20 years of my career in that Capitol building, and every day I fell in love with it, but sometimes I think I took it for granted. So it was really fun to see the gold horses, all that fun stuff. But your program is absolutely incredible. And those statistics, amazing when you look at the difference of what people, what they gain through that program, just statistically of the percentage of increase. So that was incredible. I do know that Kyla had a question early on about how long is the program? Can you talk a little bit more about some of those pieces?
Yeah, just is it the school year or is it full year? I have a couple of people I'm thinking that would be great fits, and just wondering a little bit more like, for physician schedule, could we make that work, that sort of thing, because I'm percolating on.
Awesome. Well, it starts and ends in the summer. We usually, depending on the year, some years we've started in July and ended in June. Other years we've started in August and ended at the beginning of July, or the end of June, it depends on when July 4th falls. But typically August to July is the program year. So.
And is the schedule, sorry, we have time, so I'm just gonna keep going. Is the
Absolutely.
schedule then set for I'm just, again, thinking about, we have some really great folks I can think of that are
Yeah,
serving
so we do
areas. So is it set ahead of time or?
Yeah, so kind of. So we know like what sessions we'll be having each month, but like the day and time, that's really specific to the people that we select to be in our cohorts, and we work with them to meet at like the most opportune time for them. Typically, most people have had employer support to be able to participate in this program, and we have been able to offer this during the workday. So for example, right now our cohorts are meeting on Thursdays from 12:30 to 2. But in other years, I think last year with Shelly, we did it from 3:30 to 5 in the afternoon. So a little bit later, depending on people's schedules. And we do ask about that as part of the application process, just to see, like making sure that people know that this is a commitment where, we're going to be meeting twice a month via Zoom, have that capacity and support to be able to participate in the program as well. But we do our best to be as accommodating as we possibly can to people's schedules and life and work, to make sure we meet at a time that works for people.
Hila,
great.
I'd like to throw this out there as well, is that Katie is one of the most organized people I have ever known in my life. And I am not the most organized person. And so I always knew exactly where to be, what I was supposed to be doing. There was never that element of confusion where I can say in other programs, I may have had that confusion. So Katie's incredibly organized. And I mean, you email her and she's right back, and very supportive in anything that you might need. So I found that to be an incredible asset to the program as well.
Great, thank you. And thank you for doing this. It's so important for rural areas. Just really appreciate hearing about the work, and yeah, awesome.
Thanks, Kayla. Thanks so much for joining. And I do think that's the cool thing about this program too, is it really seems to meet the folks that participate where they're at.
Yes, that's
And
something we've
that's a
talked about a
big
lot.
piece.
Yeah.
Absolutely.
Yeah, that's
And I
really our goal of the program, is to invest in rural people who want to make a difference in their communities and really meet people where they're at. Because based off of our cohorts, as you see, we work with people from all around the state, but people are coming into this work with different levels of experience in relation to policy and data and things like that. We certainly have people who have had some experience around that, but we have some people who are totally brand new to it. And so we really try to do our best to support everyone where they're at with their policy work, and help them gain the skills that they want to get out of the program, because that looks different for every single person. Every single person has gone on to do different things with their policy work as well. And I don't know if we have time, I can give it some examples of alumni who are doing really cool things. I almost added a slide about this today, but I didn't know how much time we
Yeah.
have. But
I will say too, I came in with zero policy experience. And so I'm just going to say that I'm certainly not an expert, but I learned so much. Oh my goodness. And I do feel like an empowered citizen in my rural community, that I can write policy and make some formative change here. So I love that. Katie, if
yeah,
you can
absolutely.
share, because I just feel like I think the important thing is, and I think it's hard until you've experienced it, but there was this great camaraderie that I experienced through the program, but that has continued on. And I think so many things, like it sounds really good and people do it, but then it's just like the ball drops and that's it. But this is like a continuous, I guess I said it earlier, but that pebble and the ripples that just keep going and going. And I feel like that's what your program is doing.
Yeah, unless there's like any other questions right now, I can just share a little bit about what some of our other alumni have done with the program, and their policy work. So I think one of a great example is Ann Bussey, who is a retired healthcare exec. She was in our first cohort. I have to talk about her because she's amazing. Her work in the program focused on social isolation in rural older adults, specifically in the area where she lives in the Iron Range, but really focusing on rural Minnesota generally. But her policy work has led to the leveraging of the Minnesota State Library System 5-year plan to champion digital access and inclusion and through the library system for rural older adults to be able to utilize technology in order to not just be able to access telehealth resources, but to really stay engaged with their communities. Anne has written several op-eds on this topic. She has a fact sheet that is published on the Minnesota House of Representatives website. Her policy work and all the engagement that she has done throughout rural Minnesota led her to be the winner of the Minnesota Rural Health Policy Hero Award last year, which was super cool. And she was recognized at the Minnesota Rural Health Association conference about that this last June. She was also Senator Klobuchar's guest to the State of the Union this last year because of her policy and advocacy work, which is absolutely incredible. So she's done some amazing things. At the state level, but we also have people who are doing really amazing things locally too. And I really want to be able to highlight that as well. I was just in touch with one of our program participants from the second cohort, Gina Kujava. She is the director of Kitson County Public Health, and her policy work in the program focused on substance use prevention and mental health. And through her policy work in the program, she's continued to utilize the Kitson County Substance Use Prevention Task Force and leveraging the opioid settlement funds that have come through Kitson County for substance use prevention work. And I think that's really such a cool example of something that's happening on the local level. Other examples at the local level, Adam Pavick in our first cohort, he's a pharmacist from Grand Rapids and works for Itasca Medical Care. His work in the program focused on access to culturally responsive maternity care for Indigenous women in Itasca County. And through his policy work, it's led to the creation of a DEI work group through Itasca County, and he used the alumni funds last year to host an event at Leech Lake that brought together maternal child health and tribal health experts to talk about policy and access to care for Indigenous women in the Leech Lake region. And so I think that's a really cool, another great example of local policy change that's happening through our Project Reach participants. And so people are just doing amazing things through their policy work. And like I said, it looks different for every single person. Oh, and thanks for dropping Anne's op-ed in the chat. That was really great. I don't know if there are any additional questions or. Teresa, did you have something?
Yes, sorry, my microphone just went weird there. Yeah, I was curious too. So for this year, you're looking at enlarging the cohort, correct? So
Yeah,
5 to 6,
5 to 6. Yeah.
yep. So how do you envision? And this is sort of down the road, just because I'm just listening to Shelley and all these connections. How do, how do you envision getting all the cohorts connected?
Mhm.
As you've done that, and then how c- how do you how are you going to share the learning and share all the amazing things that these guys are accomplishing? I mean, it's so incredible. I just keep trying to think what a treasure trove of amazing things that are going on in rural communities around public health. So
Yeah,
just sort of curious
absolutely.
what your plans
Oh,
are
those are
there.
such great questions. So we do connect all of our participants and program alumni together. We've tried to bring together, especially for our wrap up session that we have at the very end of the program, to invite program alumni to hear what our current cohort members worked on and build some of that networking. But oftentimes we also offer a number of opportunities and events to people who are in our current cohorts as well as our program alumni. So there are connections made that way as well. But I would love to have in the future have just a Project Breach event for everyone to like come meet each other and hang out. I know there have been a number of participants who have had a chance in previous cohorts before we were able to have our day at the Capitol who were able to get together. Our participants from our second cohort were they all happened to be at the same conference one time, and so they were all able to do some networking together and get a photo, and it was really great. But I would love to be able to have some more opportunities to bring everyone together to continue that knowledge sharing. But in terms of being able to share and capture all of this information, so I touch base regularly with all of our program participants and alumni about the policy work that they are doing, and something really cool that we're working on, and hopefully we'll be able to get this submitted at some point this next summer, is we're going to be writing a manuscript, a journal article about Project Reach, and be able to share what some of these long-term outcomes have been, and capture the work that our alumni are doing as well. So I'm really excited about that. I've just started drafting that in my free time.
I love it because, and this Teresa again, I love it because I think one of the cool things about this project is it's replicable, and
Mhm.
it's like
Yeah,
how do you share your model and get more people
mhm.
engaged, and that's
Absolutely.
so important.
And we have shared about the program. I've presented at the Minnesota Rural Health Association conference about this work. I presented with Anne and Jody Turbo Roberts from the second cohort about their policy work. We also presented at the National Rural Health Association conference 2 years ago as well. So sharing about that at a more national level. And there was definitely some interest in the program. Then we were pleasantly surprised. We were like one of the last sessions to present at that conference, but we actually had a really good turnout. So I was very happy about that. So and I'm just continuing to find opportunities to share at various conferences and meetings to share about the program and what the amazing work that our participants are doing.
Well, I love it. I know folks will have more questions, and if questions come through, I'll definitely get those to Katie and Shelley to respond. But do you guys have any closing comments and anything you want to share before we start to
Yeah,
close down a bit?
I guess I would just encourage anyone that's listening to this, that's on the fence about, I would say just reach out and do it. That I think that Katie did mention this, but it doesn't really necessarily, you don't have to have the experience. I didn't have policy work experience, but what I gained from it, but I think it's just that empowerment too of the connections and the work to make that change. So I just encourage anyone, if you're thinking about it, just go for it. It is very much worth your time.
Mhm. Absolutely. I think just encourage people to apply, and even if you're not selected for this next year, apply again next year. Like there we are really hoping to be able to continue to grow the program and be able to offer this to as many people as we can over the coming years. So there's really no harm in applying. Please just we really want to be able to invest in people who want to make a positive change in rural Minnesota.
I love it. Well, thank you both so much for your time and for your commitment and contributions to rural, because super important. And as I said earlier in the webinar, we love to lift up women who are leading for rural. So thank you so much. We will, as I said, we'll be sharing the recording. We'll share the slides on the website. We'll send them out to everyone who had signed up for the webinar, as we know that everybody's schedules shift. So I know that there's a lot of people that will be waiting on this information too, and we'll share everybody's contact. So please let us know if you have any questions, anything like that, that we can be helpful with. And really excited about this project. I'm just going to share a couple things before we close down here. Just with 100 Rural Women, and just throw our website up there, but we've got a couple things coming up that I did want to share with everybody. We have another webinar coming up March 24th. And again, we're working with the University of Minnesota and Arrowhead area on aging to talk about senior housing. So that's going to be that's such a huge issue. So that's going to be March 24th at 10 a.m. And we'll be sharing information, particulars about that webinar coming up. I also always want to share that every Thursday morning we do open networking, and Katie comes to that. It's just 30 minutes every Thursday morning at 8:30, and we never know where the conversation is going to take us. Lately, it's been a little focused on civic engagement, which has been great. And but everybody comes, and it's just a great way to connect and share. And this is also where we get a lot of ideas for our programming. So I really appreciate that. And then I just wanted to, just on our webinar series, we'll continue to do webinars, but what we're learning is everybody's so stretched. So we are going to be launching a podcast in May to better highlight women leading and women who are supporting each other to lead. So look for that information. So just other than that, thanks for coming. We will share everything out after the webinar here. And please let us know if there's anything, any ideas or any issues you'd like to know more about. And we'd be happy to find people to share that information. So thank you, everybody, and really appreciate you taking the time today and meeting these amazing women. So thank you.
Thank you all so much, and thank you, Teresa.